Hi, I'm Dr. JP Tupta with South Charleston Chiropractic, and I'm a chiropractor here in South Charleston, West Virginia. Today I want to continue to talk about some frequently asked questions that I get as a chiropractor, and I want to focus on imaging and specifically x-rays. So one very common question that I get asked during a patient's first visit in the office is, I've got back pain or neck pain or whatever the case might be, do I need to have x-rays taken? And the short and simple answer to that is probably not. So based on the best available evidence and the most current guidelines, we know that in the absence of red flags, spinal imaging is not necessary to begin a trial of conservative care. And I mentioned red flags. So a red flag is an indicator of serious pathology or some type of underlying medical condition that is either contributing to the issues that you're having or is much more serious and much more emergent than whatever pain that you're having currently. So some examples of this would be trauma, so a car accident or a bad sports injury, a history of unexplained weight loss or a history of cancer, fever or infection, progressive neurological deficits. So if you're having progressively worse numbness or weakness in your legs or in your hands, or the inability to control your bowel and bladder function, these are all examples of some very serious things that we would want to get imaging first before we ever treated you, and probably refer you out to some other provider to deal with those issues first before we're going to see you here. Now, the vast majority of patients that we see do not have any of these red flags. They're relatively easy to screen for, and so we can do that based on the history and exam. We don't need any special tests most of the time. So we are completely safe to go ahead and start a trial of care. So that'll usually consist of the chiropractic adjustments, corrective and rehabilitative exercise, massage, any kind of soft tissue work, as well as at-home exercises. These are all things that are completely safe to do and are very effective for back and neck pain that do not require x-rays. For a long time, it was standard practice among chiropractors to basically x-ray everyone that came into their office. We thought that, well, we're going to adjust your spine, shouldn't we look at it first? Which in theory makes sense, but research has shown that patients who are x-rayed prior to care versus patients who aren't, there's no difference in clinical outcome. Actually, people who aren't x-rayed have a little bit better outcome, because what can happen a lot of times is you'll take an x-ray of someone that maybe they do have back pain, maybe they don't, and you'll find something that's abnormal. Maybe they have some degeneration in their spine, maybe they've got a congenital anomaly or variant to the way that their spine was formed, and you show them this, and a doctor will say, this is probably where your pain is coming from. Even though we have no way of telling based on an x-ray where the pain is, we can't see pain on an x-ray. That in turn leads the person to think, oh man, I'm damaged, my spine's messed up, I'm going to have a lifetime of pain, especially with things like thinning of the discs and arthritis, osteoarthritis in the spine. These are normal changes that will happen to all of us as we age. Just like our hair will get white, we'll get wrinkles in our skin, we're going to have degenerative changes in our spine. And these are sometimes the cause of our pain, but most oftentimes they are just kind of a bycatch or a secondary finding on an x-ray that it's not clinically relevant. So all that being said, my whole point with this is that you do not need x-rays to get adjusted. Your chiropractor should not be taking x-rays unless there is a clinical indication to do so. And if you have any questions about that, please feel free to leave a comment below. This is something that is highly debated, I know, among chiropractors. I'm sure among medical doctors and PTs as well. But this is something that is relatively new. In the past 10 years or so, the guidelines have really changed, and the research has shown that imaging is not necessary for non-complicated lower back and neck pain. So like I said, leave a question if you have one, leave a comment, subscribe to my YouTube channel, and thank you for watching. I'm Dr. JP Tupta with South Charleston Chiropractic.